You're listening to the Better for America podcast, presented by Amac, the Association of Mature American Citizens.
Hello, everyone. I'm Rebecca Weber, and this is your Amac podcast, Better for America. Today, we have with us Congresswoman Diana Harshbarger. She is the representative of Tennessee's 1st Congressional District, where we have nearly 10,000 AMAC members in your district alone. Welcome to AMAC's podcast, Congresswoman. Lovely to have you with us today.
Thank you, Rebecca. It's a pleasure to be here.
Excellent. Little background for those that may not be all too familiar with you. You are a native East Tennessean, Congresswoman, and you were born in Bloomingdale, just a small community right outside of Kingsport. And it was interesting to learn that you were the first in your immediate family to graduate from high school and college. And although your parents, they may not have had the opportunity to further their own education, they taught you the value of hard work at a young age. You attended East Tennessee State University and graduated from Mercer University College of Pharmacy. And after graduation, Congresswoman Harshbarger returned home to start a business and raise her family. So Diana has had a successful business for over 3 decades and is dedicated to fighting for healthcare reform, economic development, combating the tragic opioid epidemic, and expanding broadband access for rural communities. Congresswoman Harshbarger also currently serves on the House Education and Labor and House Homeland Security Committees. So again, thank you for being with us today. I wanted to jump right in and talk to an issue that is very important to AMAC members. We've got nearly 2.4 million AMAC members, and our members understand that prescription drug costs, oftentimes it's so expensive that people need to decide or make the decision, is it going to be my medicine or food? So we're always working hard here at AMAC to help reduce the cost of prescription drugs and offer the kind of price transparency that all Americans should enjoy. I wanted to talk to you a little bit about the pharmacy benefit managers, which are known as PBMs. We know that they have tremendous impact on our healthcare choices, right? Because they administer drug plan coverage for more than 260 million Americans. Congresswoman, I wanted you to talk a little bit about your bill, H.R. 1829. You sponsored this bill. This is the Pharmacy Benefit Manager Accountability Study Act of 2021. And I wanted those folks who are listening to better understand and what exactly is a pharmacy benefit manager, or a PBM. What role do they play in outpatient prescription drugs? And why is there a need for the type of legislation that you've introduced? Big question.
Well, that's a big question. And it's one I've been asking for the last 25 years when it comes to pharmacy benefit managers. I've been a pharmacist for 34 years, and I've been a business owner for over 30. And as a pharmacist, I know that the PBMs, or pharmacy benefit managers, need reform. But a lot of people don't even understand what they are. They're one of probably the least understood components of prescription drug spending and pricing in the United States. And they play a huge role as the middleman between the pharmaceutical manufacturers and at the pharmacy level, basically. There's so much that they do that people don't understand, and you wonder why certain drugs are on that are covered, that your healthcare provider may write, and there's certain drugs that aren't covered. And the bottom line is, it's the pharmacy benefit manager who absolutely will tell a plan sponsor what is covered, what isn't covered, and what your copays are. The role that the PBMs play is phenomenal. And there's been a lot of vertical integration in the last several years to where there's not that many out there. And what they say is gospel, basically. It drives the price up, and those, you hear about these rebates. There are so many things that it's almost like a calculus problem, Rebecca. And what I'm trying to reduce that to is a simple addition. And it's not something that I go spouting off to everybody. The average American's not going to understand this, but we have many physicians in Congress. I'm in the doctors caucus as well. We are hot on the trail of these pharmacy benefit managers because take insulin, for example. A pharmacy benefit manager may put a $900 insulin on the formulary, but they may negate, say, if there was a lower price alternative or a generic that's out there, they're not going to put them on the formulary because they do not get what we call manufacturer's rebate from those.
These are kickbacks, essentially. It sounds like they're kickbacks.
And it's a pay to play, if you want to know the bottom line. And what this bill would do is it would commission the GAO or the Government Accountability Office to study these pharmacy benefit managers. Doesn't matter how many hearings I'm in. My question is, all right, who are these PBMs accountable to? Who audits them? Because they certainly audit pharmacists. And
isn't that something?
The patients in East Tennessee or all across the country, honestly, if they prefer to go to an independent pharmacy, it's almost like they penalize you for doing that. It's a travesty, Rebecca.
Yeah.
There's many things we can uncover, but what specifically do you want to know about these pharmacy benefit managers?
Well, I think what I want our folks that are listening to understand is that AMAC has been working very, very hard to expose the business practices of these drug middlemen. And so I think that what you're saying to us is what you're explaining is that the PBMs, the pharmacy benefit managers, have no oversight. There is no real benefit to individual American people to have this middleman involved. It's not as if they're working to bring the best of the best drugs to the table or to help reduce costs. Rather, they're earning money and they're sort of steering, it sounds, if you will, which drugs will be sold at what cost. And it really is benefiting their own pocketbook. And so for you to be so bold and to help expose these business practices, I think should be applauded. And this legislation, H.R. 1829, can you explain to us specifically what this legislation does?
Absolutely.
Thank you.
Medicare, Medicaid, commercial plans, all of these different plans use PBMs to manage your drug benefits, okay? And from just what I told you, they wield enormous power as a middleman on a whole lot of fronts. For example, they choose what drugs are covered by the insurance and which ones are not. They negotiate purchasing deals with drug manufacturers. They determine the copays that consumers pay. They decide which pharmacies will be included in prescription drug plans. They decide how much pharmacies are reimbursed for that drug. They do all those things. And what this bill will do, it will help legislators understand the role that pharmacy manager has. And like I said previously, it would require the Government Accountability Office to study and report back to Congress things like, what is the role that PBM plays in the pharmaceutical supply chain? What is the state of competition in the industry? Their use of rebates, how much goes to patients, how much goes to payers, how much is kept by the PBMs. It will determine whether, it'll look at the PBM structures and how they structure their formulary. Do they structure them in favor of high rebate prescription drugs over lower cost alternatives? And I can assure you they do. It'll also determine the extent to which the price of PBMs, what they charge for a drug to the government program versus the private health insurance plans, and what they pay private pharmacies. And this has been uncovered for years. I remember going to Capitol Hill, and I've been doing this for 25 years, going to my congressmen and my senators to let them know, wait a minute, there's not a level playing field here. And letting them know that there is such a spread that it is unfathomable that an independent pharmacy can stay in business. I'll tell you what your indicator is when things get out of hand is when a lot of the bigger pharmacies, like the chain pharmacies, start yelling, there's a problem with reimbursement. And, sometimes they will require healthcare providers like your, of course, physician's offices to do what we call prior approval. And most of the time you go through that rigorous process, and ultimately at the end, they'll still deny the drug coverage, which is a travesty to a lot of patients. They'll have to use an alternative. But this bill would require that GAO to answer every one of those questions. And, Importantly, it would also require the GAO to make recommendations to Congress for any kind of legislative action in critical areas like lowering the cost of prescription drugs
Well, this is
for
very
consumers
much
and for
needed.
payers.
Yeah, this legislation
Oh my
very
goodness,
much
yeah.
needed. Do you think that you'll see much bipartisan support? This certainly seems like everyone on both sides should be very much concerned and willing to work on together.
Well, absolutely. We're reaching out to every office. The Doctors Caucus know I've already got several co-sponsors. They're all Republican co-sponsors. But what congressman or congresswoman does not have an independent pharmacy in their district that are begging us to do some kind of reform. And their Medicare and their Medicaid patients and their private insurance companies, their plan sponsors, like their self-insured plan sponsors, they're taking a leak too. They don't get the rebates. They're promised the world when they sign up with the pharmacy benefit manager. We absolutely need transparency, and I've talked to a lot of different groups that have PBMs that are transparent. And that doesn't even take into effect things that affect regular pharmacies, like those direct and indirect remuneration fees and clawbacks that you're doing through audits. And it sometimes goes to that patient level. They will call that patient and say, did you truly get this? Did this happen? And, it puts doubt in their mind as to the pharmacy they're using. Is that legitimate pharmacy? I mean, it's to a point. And when I mention vertical integration, when a pharmacy buys a pharmacy benefit manager and the FTC doesn't step in and say, oh, that shouldn't happen, that's a travesty. And it's continued to go on to where you have three big players that cover 80% of this market, and that's not fair.
Yeah, well, we'll be tracking this piece of legislation, and I appreciate you sharing, some knowledge. Folks need to understand that this is not good for the cost of prescription drugs, and certainly not good for the American people. I want to shift and ask a question about the Freedom to Work Act. We've been in this pandemic for over a year now, and I know that you have been working very hard, rather, to cut through the red tape to get Americans back to work. And recently, you introduced the Freedom to Work Act. And so, can you tell us a little bit about this bill and what your ultimate goal would be?
Well, people are very slow to re-enter the workforce. It's at a crawl, and if you look at the the last numbers that came out as far as jobs report, it was a travesty on that too. People can make more money at home than they can going back into the workforce. But
yeah,
it is a shame that you would have to incentivize people to get back to work. This Freedom to Work Act talks about. Really, it involves occupational license requirements. And what that does, in some cases, that prohibits a lot of these people from going back to work because they have to pay these fees. And this act would require, different states. It encourages states and federal government to roll back those burdensome occupational license requirements. And, I work with Jim Banks, Chairman Jim Banks, on the Republican Study Committee on introducing this legislation. And it is included in his balanced budget bill that we talked about last week, as a matter of fact, balancing the budget in 5 years. And, studies show that the occupational license regulations cost taxpayers about $203 billion every year, and that reduces the number of American jobs by 2.85 million. And it really harms the low-income worker. And right now, approximately 1 in 4 occupations require that license, and that's compared to just 5% 60 years ago. So what this act will do, Rebecca, is it will direct federal executive agencies to regularly review those policies that may cause states to adopt all these unnecessary occupational licensing requirements. Did you know if you work as a shampooer in a hair salon that you have to have a license, you have to pay, and you have to go through so many hours of training to do that?
Yeah.
Could you believe that?
That's
just one example.
That's a good example. There is so much in the way of government just always looking for some sort of power grab, and they do it under the guise of consumer safety. I think that people are not aware. Yeah. That's why it's so good that you point these things out, because these small, what may seem to be, oh, we're gonna impose these new licensing requirements on small business. What it really does is it crushes small business. It's not good for the economy,
Oh,
and it's
absolutely.
costly. It's costly for businesses to implement. So I think that it's a wonderful the Freedom to Work Act, which essentially directs states and the federal government to identify the unnecessary occupational licensing barriers that prevent Americans from returning to the workplace, is very, very smart legislation, and we're very pleased to see that you are committed to eliminating this red tape. I want to
Yes,
jump
ma'am.
over to I can't speak with you and not talk to you about the border and the crisis at the border. AMAC publishes a bi-monthly magazine, and our latest edition should be hitting mailboxes in the coming days. We've got a picture of the border wall crisis on the cover of our magazine. And we're calling it Biden's catastrophe because he certainly hasn't done the job that the American people, I think, put him in office to do, and that was to put America first and to protect America. And then, of course, we see Vice President Harris. After weeks and weeks and weeks, I think we're nearing 50 days or something like that. She has not yet
Yeah.
been to the border wall. Congresswoman, you visited the border wall, the southern border, and you said that what you saw was worse than what you had imagined. You even described it as a grave national threat. Can you tell us what you saw at the border? Let the people know what's happening because we're hearing on mainstream
Mhm.
media that the border wall is closed. Is it closed? What did you see when you were there?
Mhm. Well, if it's closed, they didn't tell anybody around these parts. Every state is going to be a border state, and I mean that. Um, it's really disorder at the border. It's what Ranking Member Katko called it, and that's what it is. It is a national security, a humanitarian, and a public health crisis. And yes, I did go to the border. We went on a nighttime brush raid with Texas Rangers and Special Ops. And we went on the gunboats, where Mexico's on one side, the United States is on the other, and how they capture those people coming across the Rio Grande Valley that way. But we went to the border itself, at night, and we saw people walking up, and they just turned yourself in. And the travesty is there's a lot of small children. Going to the Donna Detention Center was heartbreaking for me because here they are. We are supposed to have kept mask on, 6 foot distance and all that. And when you see these children, they're right on top of each other. What you see on TV is what it's like, and it's worse than that. And when you see these Customs and Border Patrol agents who really do have a heart, and they have such a hard job, they're questioning these little babies. And I remember seeing one talking to a young boy, and I asked, how old is he? And he said he was 6. And that put a righteous anger in my spirit because that's like my son and daughter-in-law sending my 4 and 6-year-old grandsons across the border by themselves. And that's what happens with a lot of these children. It is child abuse at the greatest rank, if you ask me. And I'm going to tell you something. When you see 18,000, and it's up to 20,000 or even higher at last count of unaccompanied minors coming across the border, the U.S. is becoming the biggest human smuggler of illegals across the United States border, period. That's the bottom line. And if they're allowing it to happen, they can say it's closed, but they just move them from one facility to the other. And it's unconscionable to see those precious babies in there. And these Border Patrol agents are demoralized. When you have to pull 40% of your Border Patrol agents that are patrolling the border off to bring them in to process these unaccompanied minors, that's a travesty.
Yeah.
And when we were there, they also said that they were going to have to use some Canadian help to process these unaccompanied minors. Now, that's, when you leave the border wide open, that's another avenue for drug smuggling and things. But one
it's
thing
terrible.
that
I mean,
resonated with
the human trafficking, the drug smuggling, the gangs that are coming in, the single males that are coming over, the unaccompanied minors that
Yeah.
are crossing each and every day. This is really a Biden-Harris self-inflicted crisis that they recognize, that
yeah.
they've got to see. They're ignoring it intentionally. And Congresswoman, I've spoken with dozens of people over the last 60 days. And these people are all saying the same thing, and that is that this is something that is being done by design, that the Biden administration is looking to welcome as many illegals into America in order to strengthen their own party. And, it's hard for some of us to want to accept that as a possible motive. But when you try to find any other reason why they would turn a blind eye, especially when Vice President Harris really, this was what she ran her campaign on. She said that the Trump administration had 2,500 youngsters that were separated from families. We're up over 20,000. The numbers have skyrocketed. The issue is it's so bad, and they want to tell people like me and AMAC members across America that the border is closed. But we know that that's not the case, and they're failing to provide us with any solutions. This is very, very dangerous for America and for our future. Go ahead.
Well, you could fix it overnight. You know how to do that? You just re-implement President Trump's policies.
That's
it's
right.
Very simple. You put the Remain in Mexico policy back in place. You make sure that Title 42 stays. We're still in a pandemic, and they're allowing people to come over, and we don't even know if they're tested when they're put on planes that the American taxpayer pays for to be shipped into the interior of this country. And the national security threat is the aspect of 25,000 gotaways so far that they've seen on camera or aerial. They don't know who they are, where they come from, or where they're going. And you wonder, after they catch, 6 that were on the most wanted, the terrorist list, we don't know who these other people are. The American people need to know how bad this is when you've got 200,000 coming across the border every month, and you see the heroin seizures. They've increased by 97%. You see fentanyl going up, and the sheriffs in my area say that methamphetamine uses and the sale of that has gone up by 40%. And guess what? The drug use has gone up because the price has gone down. So I don't have words to describe
We've
what's
never
going
seen
on.
it before.
Yeah, unprecedented.
It really is.
Never.
It is a sad time, but this is why it is so important that folks are aware of the information and content that we're putting out, both on our website at amac.us, and also for those of you who have not downloaded the AMAC News app. What I love about our news app is we're ad-free. We don't take any information, no email. There's no cost, and we're putting out information every single day. Congresswoman Diana Harshbarger, thank you so much for joining us today. You are representative of Tennessee's 1st Congressional District. I think I mentioned to you, we have nearly 10,000 AMAC members in your area. So for those of you out there listening, especially for our members from the great state of Tennessee, I'm sure they'll be thrilled to hear some of your main priorities and initiatives. And I want to thank you for joining us here today.
Rebecca, it's been my pleasure, and I'll come back anytime.
That's wonderful. We sure will have you back again. Thanks again for joining us, and for all of you listening. This is your podcast, AMAC's podcast, that is Better for America. And we look forward to having you back with us again next time. Have a great day, everyone.
Thank you for listening to the Better for America podcast. To learn more about AMAC and all it has to offer, visit us at www.amac.us.